Welcome to Behind the Muscle podcast. Today's guest is a sports chiropractic doctor. Today's guest is Dr. Deigo. Deigo, welcome to the podcast.
Thank you so much for having me, man. Really
For
appreciate it.
sure. So, Deigo, I'm really looking forward to getting into your story. I'm really looking forward to getting into your practice and being a doctor of chiropractic and all the athletes, top Olympians that you work on and work with. I think you're the first actual chiropractor that kind of does this full time that I've had on the podcast. So, really looking forward to the chat. Before we kind of get into your upbringing, your backstory, why don't you let us know who are a few of your favorite bodybuilders of all time?
I would have to say Louis Ferrigno and Jay Cutler. Louis Ferrigno, just the fact that he's one of the originals with Arnold. But what I like about Louis Ferrigno is he had this speech impediment, right? People used to pick on him, and that's one of those things that attracted me to bodybuilding. Because most of us really start going to the gym because you were bullied or anything like that. So being an immigrant, and having an accent, going to school, it's kids are mean, so they're gonna pick on you. So Louis Ferrigno was one of those guys that really attracted me. And also watching the show, The Incredible Hulk, growing up. And then in South America, the way it works is back then, not anymore, not so much anymore, but back then, shows from the 70s, they will get translated like in the mid 80s to Spanish. So I grew up with everything from the 70s as an 80s kid. So like Knight Rider, Arnold's movies, Louis Ferrigno, all that. So that's one of the reasons why I like Louis Ferrigno so much. And then the fact that he came back in the 90s again was incredible. And Jay Cutler, obviously, what he has accomplished. Being a bodybuilder and outside the bodybuilding industry. Nowadays he's one of the most known bodybuilders in the world. Even last time he competed was 10 years ago, and everybody knows his name. So those two are definitely the ones top of the list.
Very cool. Okay. What age did you start lifting weights, and then why did you start lifting weights at that age, Deigo?
The age of, I would say 14, 15. Again, I was growing up, got a little tall. I was a tall, slim kid, immigrant with a big accent. And I was like, okay, I was playing soccer. I liked it a lot, but then I got really tall and I look a little weird. That age, the 15 age. And I'm like, okay, what do I do? So I started eating and I started working at this restaurant. Funny enough, it was a Mexican restaurant. So the chef there was another immigrant. And the funny thing is, he was a Mr. Colombia. And he was a chef in a Mexican restaurant, but also an immigrant. So he was working there. So I asked him, he looked like, to me at that age, he looked like Arnold Schwarzenegger. I mean, he looked incredible. And I was like, hey, can you give me a couple of tips? He said, hey, don't worry. He's like, you can come to the gym and work out with me. I was like, really? He's like, yeah. I was like, oh, well, I don't know how money. He's like, don't worry, you're a kid, So I actually was training with Mr. Olympia. I don't know what year, he got Mr. Olympia or whatnot, but I was training with him back in, when I was 15 years old. So he taught me a lot. And he always told me, pretty much, he's like, hey, no matter what, he's like, don't take any drugs or anything like that. Always be natural. Always be natural. He's like, if you ever do anything, he's like, wait till you're later on in life when you understand what's going on. So that's actually like kind of got engraved in my head. So I always got to the wellness side of things for that major reason. Because I think just knowing that and when he told me like all the bad things that happened with him, it kind of like shocked me a little bit. So I was like, okay. So I never really got into that side. So that's why I really like chiropractic care, because it's the wellness, healthy, eating good, nutrition, diet, supplements. So I have to thank that guy because he was inspiration to me.
Very cool. I love that. That's great, Deigo. Okay, now you mentioned being an immigrant. You mentioned South America, so I'm assuming you were born and raised in South America. So I would like, if you don't mind, for you right now, Deigo, just to kind of share a little bit more in depth and in detail about your upbringing. What was your childhood like? when did you guys or when did you come to the States? And just walk us through a little bit about your younger years up to about high school. And then I've got some questions that kind of transition us from that point.
Well, my mom came here. It was actually, I have two older brothers and a younger sister. So it's actually four of us. And just like any parent, my mom came for a better future for her kids. And growing up, again, being an immigrant, my mom didn't have a lot of opportunities, not knowing English. We had a lot of family here that were very successful, doctors, engineers. So that really helped out. It kind of steered my mom the right way. But again, she's still an immigrant. So when she got here, she was cleaning houses till, I will say 8 years. So my whole, my growing up was not, I wouldn't say tough, but definitely was still tight on money. But there was a lot of love in the family. There was always a lot of food in the fridge. Being a Hispanic family, that our fridge was always full of food, no matter what. Our rooms were, small. Maybe we were sharing rooms, but there was a lot of food. You will come over, and then my mom will have a huge plate of food for you, no matter what. Right. So that was always nice. So when you come to my house, I always have food for everybody, no matter what. So, growing up, again, being four siblings, it was a little tight. So I started working really early. I was 13, 14 when I got my first job, just to provide for myself and get a little more things. But just going to school, again, having that getting pick on, bully, or not, I will say bully, but pick on, those little jokes here and there about your accent. And, that'll kind of affect me. I always knew it was okay. So that's one of those things that really attracted me again to bodybuilding itself. Getting bigger, you start getting bigger. Kids are not messing around with you anymore. They start thinking twice before they say anything. So that was great. So I was always quiet. I was never really an aggressive kid. I was just quiet to myself. And, the bodybuilding side, the size really helped me because people didn't want to bother me. So I was to myself doing my own thing. And that was great. By the age of, I would say, like you said, 15, 16, I really got really hardcore into it, and I got the size and all that. After pretty much that was it for my high school years, pretty much. And again, middle school, just being a teenager, I guess, nothing else. And after high school, I really got into college, and then that's when I really started seeing the chiropractic wellness side of things.
Now, you mentioned soccer earlier. Is that a sport that you played all the way through high school? And was that something that you enjoyed? Was that kind of an outlet for you at some points in your life or not?
Yeah, growing up in South America, soccer is one of those things that everyone watches, everyone loves, and everyone has a passion to it. When I came here, it was, I still loved that. I played it all till I was at my first year in high school. I played it, and that's really when things changed for me. But it was still a passion. I still play to this day. It's a little more difficult when you have more size on you, but it's one of those sports that, just the World Cup just now. You just watch it. You love it. It's a little different. Some people don't understand America because still that passion's still there. But they play for most of my youth, and I guess anyone who's from South America plays that sport.
Now, at what age did you come to the States? And when you guys came here, did you move to Florida? Because I know that's where you're at now, or was it somewhere else?
We came directly to Florida. We were in South Florida for most of my time. They were there. I got here when I was at the age of 10. Yeah, about 10 years old. And after that, we pretty much stayed that I was 17, 18. And growing up in South Florida, it's completely different than anywhere else because South Florida, it has a combination from everybody from all over the world. We have Colombians, Puerto Ricans, Cubans. So your upbringing is really different, and it's fun because there's not really, I would say, racism, because it's so many cultures together. So when I speak Spanish, it's actually really difficult to know where I'm from because I got a mix of many things in my accent. So nobody really knows where I'm from. So I'm like, oh, okay, well, I grew up in South Florida, and Most of my friends were Cubans, Puerto Ricans, you name it, Haitians, anything. So it was nice. It was a nice it was a nice to grow up there, other than somewhere else in America, which I believe if you're somewhere like in Ohio or anything like that, being one Spanish family, that would be a little bit different too,
Right.
a little more tough, I would think.
Yeah. Now, I'm assuming academics was something that was stressed very highly in your home. Am I correct on that? And talk about, did you enjoy academics when you were younger, or did it take until maybe after high school that you really got into the academic side of things?
Yeah, I will definitely have to go in the second part. Yes, 100%. Later on in life, I started realizing how important it was. It was always stress being Hispanic. Become a doctor, become an engineer. I mean, typical Hispanic upbringing. Your dad is a lawyer, your uncle is this, your uncle is that. So that was always part of it. So I think that's why I became a doctor. But also, I mean, I love that. I find my own self. That was one thing that was always stressed to me. And again, like growing up, it was a little tougher for me. Not knowing the language that well, and then reading things, I would be like, oh my God, I have to read it 4 times before I get it. So it was really tough. My middle school and high school was really tough, and I was a little lost. But I was lost in a different way. I wasn't lost, doing party anything like that. I wanted more, but I didn't have that somebody to back me up with it. Being my mom, having 4 kids, trying to provide. My dad wasn't around, so I didn't have that somebody pushing me, doing, hey, apply to the school, make sure you get your SATs. My mom was like, oh, are you doing good? Are you full? Is your stomach good? Okay, good. Great, you're happy. Okay, great. But there was never a real push. So that's, I think, affected me. Not again, it wasn't my mom's fault. It's just the way things are. But by the time when I finished high school, I was lost. I was like, oh my God, what do I do now? Do I join the army? Do I become a cop? It's completely lost. So I actually went to community college for almost 3 years. I mean, I had so many credits. It was outrageous that they called me down to the office one day and they're like, hey, like you have 150 credit. Like you should be graduating like a year ago. I was like, what's going on? And I was like, well, I really don't know what I'm doing, And then I had a professor and back then he kind of taught me, like he's like, hey, what do you like? He really showed me what path I should take, and that really clarified things for me. So once I knew what I wanted, like after I would say 3 years of my life in college, in community college, I was like, okay, I know what I want. So I went to FAU and I got my bachelor's degree in a year and a half in exercise science because I knew what I wanted. And that's really what I focus on. Like, okay, I want to do physical therapy or I want to do chiropractic care. And the reason why is because I love bodybuilding, the wellness, the anatomy, the physiology, the kinesiology, all the changes in the body. I love that. So I was like, okay, what can I do to achieve that and fast? So I was like, okay, this is what I have. And then I was like, okay, well, I like physical therapy. I like chiropractic care. And I was like, oh, I think chiropractic care is for me. And you have to remember that being Hispanic, chiropractic care is not something that we even think of. I don't even know what that is. Like when I told my mom I was becoming a doctor, she was like, all right. I said, oh, okay, chiropractic doctor. She's like, what is that? She's like, oh, you're gonna become a bone cracker. I'm like, what? She's like, yeah, we have that in South America. It's they call bone crackers. It's like a witch doctor. And I'm like, oh God. I was like, no. I was like, no, that's not it, mom. But close enough. No. But she's like, well, you're a doctor in America, so that's all that matters. I was like, okay, mom, thank you. I'll take the win.
Yeah. Okay, now before we kind of get into your professional side, I want to take a step back. So you had the opportunity to connect with this gentleman at this restaurant that you started working at that was a bodybuilder, and he kind of introduced you to bodybuilding training and took you to the gym. At that age, when you were a teenager, when you were kind of introduced to the strength training, you kind of mentioned that it probably gave you some sort of confidence, but it sounds like that the strength training and that lifestyle kind of helped you determine when you were in your early 20s, like the direction that you wanted to go with your life in terms of being a chiropractor and being kind of more on the wellness side of things. But Did you continue to lift weights? Like when you were going to that community college for those 3 years, were you continuing to lift weights? Were you continuing to train? Like talk a little bit about how that maybe gave you some, direction and stability in your life when you were trying to figure things out as a young man, Deigo.
I will have to say that 100% when I talk to anybody who's a teenager and even a parent, I always let them know how bodybuilding has affected my life, right? And all the good things about it. Um, it keeps you that when you're young, right? When you want to have a drink or you want to smoke a cigarette, it gives you that, well, if I do this, it's going to affect my physique, my wellness overall. So that's one thing that always kept me away from all those drugs and alcohol growing up as a teenager. I'm talking about like 15, 16 years old. I was okay, well, I don't want to do that because I worked so hard for my physique to look like this, and I get really good compliments. And then as a 15, 16-year-old, you get compliments, and you're like, your self-esteem goes, high. You're like, oh my God. And then when you have a drink, you're like, boy, I don't want to do those bad things because I'm gonna miss a day at the gym. So having that system, inside of you, and that drive really keeps you in a good path. So I always, even though like I understand that bodybuilding is extreme sport, but I always try to, when I talk to the parents, the patients, and the younger ones, their kids, I always try to tell them that, hey, let him work out, let him do this, because it's done for me, and it really has kept me in a good path to just be a good person overall. Um, so yeah, man, like bodybuilding has like taught me a lot of just consistency. Be on top of things. When things you push yourself, you can accomplish whatever you want. So just be on top of it. It teaches you with work. You can use that at school. Work hard, you'll get what you want. Work hard, you'll get what you want. Keep doing those reps, keep doing those sets, and you will get what you want. And that's how I did in chiropractic school. Keep studying, keep doing this, keep doing that, and you will get your degree. And next thing you know, I got my degree, so it worked out.
Excellent. Love it. Okay. So you go to community college for like 3 years. Then you get some guidance from a professor and you go to FAU, which that's Florida Atlantic University, correct?
Yes.
Okay.
Yes.
Just for everybody that's not from Florida, so they know where that's at. You get your bachelor's degree in exercise science from FAU. Once you graduated with your bachelor's degree, what was the next step in the process to becoming a doctor of chiropractic after that?
We had in FAU, we had a speaker from a Life University coming in, and at that time was another really good professor, Mr. Borum. He brought this guy in from the Life University, for the chiropractic school. He talked about all the good things about it, but pretty much trying to sell the school, right? Which is sometimes it's a turnoff, but he was so enthusiastic about it, and actually got my attention because I was looking at chiropractic schools and physical therapy schools, and he was good friends with my professor, so we were able to have lunch right after because he knew I was really interested about it. So we had lunch. I talked to him. He's like, hey, you know what? He's like, if you apply now, he's like, I'll waive everything for you, like the application fee and everything, because I know your professor. You come highly recommended. And I was like, oh wow, okay. I was like, being a broke college, so I'm like, wow, great. So next thing I know, he's like, okay, boom, boom, sign up here, boom, boom. And then 6 months later, he's like, I'm in Atlanta. I'm moving there. So that was a big change, because prior to that, I wasn't doing a lot. I didn't do much traveling. I traveled, but I was always in South Florida. So when I did that big change, to me, it was huge. Being 24, 25, I was never been outside South Florida, surrounded by my whole family. So when I moved to Atlanta with my girlfriend at the time, who's my wife now, that was a big, big change, and it was an eye opening. Being in a different state, different school, and actually, going to school for what I really love.
Yeah. So walk us through, what was chiropractic school like? Was it a challenge for you? Was it something that you found pretty easy just because you had that love and passion for it? Like, talk about that experience, Deigo, please.
I mean, most people, like, to this day, don't understand what chiropractic care is, and they when they see my page on Instagram or anything like that, they're like, okay, you're a masseuse, right, a massage therapist or whatever, right? So I'm like, well, hold on, guys, like, I don't get offended. I don't really care what people, because as I grew up, somebody always had to put me down, right? So for whatever reason, even because I worked out and I look better than them, because usually they bully you because you're better than that person, right? So they want to bring you down. So I'm used to it. So people, when they say things to me, I don't really care. So nowadays it's one of those things that when you say anything, I just don't even say anything about it. But again, like the only time I say anything is when they call me a masseuse, and they're like, oh well, they're trying to bring down my profession, or when I'm working with somebody, they don't understand, like most of those athletes, like the Olympians, are like, oh, you're a masseuse, and that's when I say something, because I want them to understand what I actually do. So again, chiropractic care, like we just going to the chiropractic school. At first, it was an eye opening, because the classes, they go so fast. They go by quarters, so it's 13 quarters. It's about 3.5 years if you do it nonstop. And it took me 4 years. I took a little stop because I got married. So it's about 3.5, 4 years. But it's 13 quarters and 11 weeks classes. So you take about like 8 classes with lecture and labs. So it's intense. And then, it's just after 5 weeks, you get your midterms. And then the last week, it's hell week. The 11th week is all finals and labs. I mean, it was the first quarter was like an eye opening to me, because I was in pre-workout like every day, like pre-workout twice a day, just to stay awake, in coffee. I was like shaking. I was trying to stay awake, trying to learn everything. So I will like finish one lecture, and I'm like, okay, I'm done. I'm like, oh wait, I gotta stay for the next one. Okay, pre-workout, which is terrible, don't get me wrong, but it's the worst. But that's how you do it, because you can't keep up. So it came natural, yes, because that's something I wanted to do, but it was tough, just that fast pace of the things. And again, on the 11th week, it was pretty much just like math. Okay, I have an A in anatomy, so I can get a C on the final. It was one of those things. You have to like know it's impossible to get like straight A's. I mean, some people do because they're really well. They that's perfect. But the way I did it was, okay, A here. I had to get an A in this class, P in this class. It's you gotta start playing around, because sometimes you do have a life, right? So you want to go out, so you want to go out with your wife and have a drink, or go to a restaurant. So sometimes I was like, okay, well, I don't have to study that much for this one, because I have an A in the class, so I can get a C. So it was one of those things, but it was definitely tough going to school. And again, I just didn't have time to do anything else. You really don't. It's like a nine, like 8 to 5 kind of thing. You will come home and you were exhausted. Like I barely had time to go to the gym. So school was like number one, like Monday to Friday, and when the weekends I had to study my butt off. So it came natural because I loved it. I knew what I wanted to do, but it was tough.
So talk about graduation day, because obviously, like you said, you're an immigrant, and you had a great upbringing, but maybe not a ton of money or anything like that. But you, through hard work, through discipline, you earned your doctorate degree in chiropractic, and that is something that's awesome. So on graduation day, talk about maybe the sense of pride that you had and accomplishment, and just talk about a little bit of the feelings, the emotions on that day, because I'm sure it was pretty awesome and a little overwhelming maybe.
Well, during the time in Life University, most of my family was in South Florida. My last year, I actually transferred and I finished up in Palmer College, which is in Daytona. And so that was my last year. I moved there. I moved back with my wife, and we finished school over there. I mean, when I graduated, it was not just a win for myself, but it was a win for my wife, because she was really the one that was there the whole time with me, emotionally and financially. Being in school full time, you can't work. I mean, I would do some personal training here and there, but nothing that will, nickels and pennies, right? So it wasn't really that much. So she's really, when I graduated, it was not just being proud for myself, but proud of my wife for standing by me for so long, and knowing that, hey, you know what, you can accomplish this, and we did it together. So, and then obviously our daughter, she was very proud, but it's just between me and her, we were just like, oh wow, we did it, like this is for us. And again, like I've always been really good at making friends and making connections. So the good thing about me is like as soon as I graduate, which it didn't give me that time to think, to be like, oh, I took it in and I was like, oh, I'm so proud, and I had time to like digest it and party, anything. It was more like I graduated on Thursday, right? Yeah, I got it on Thursday. I got my diploma. I handed in my diploma on Thursday, but because I was really outgoing and I knew how to talk to my patients, I was friendly. My professor in the clinic, he had actually 2 jobs lined up for me right after graduation. So on Friday, he's like, hey, he hit me out. He said, I'm late. What's going on? He's like, I got 2 jobs for you. So I talked to my buddy. He's like, they want you. I said, really? I was like, okay. Well, I was like, I went on Monday. I did a call, and I had 2 offers. And after that, it was just like, I was like, well, at that time, I was like, well, who's paying me more money? Because you're being broke. I didn't really care what you have to do. I was like, either, and work with the patients or clean toilets. I mean, I didn't really care, So I was like, okay, I'm working in the office. I'm a doctor now. So I was like, well, which one pays me the most? I'm like, I'm like, okay, hang up. I was like, he pays me the most. I'm gonna call him back again. So I was like, yeah, I'll take that. So on Monday, I walked in. So I graduated Thursday, and on Monday they handed me my first check. So that was really proud, because then that was like, look what I got. I got home and I was like, look, I got a check. That was to me more proud than actually getting my diploma, because it's just the fact that you finally get paid. It finally paid off. So that was like, I think I remember that day more than I got my diploma, because I knew I was getting my diploma. I didn't know I was getting the job, because they promise you so many things in school, like you're gonna have this, you're gonna be making $200,000 when you go to school. Like, no, you're not. So it's like, so I already knew this. So I was a little disappointed. I was like, oh man, this is gonna be so hard. I said, what do I do now? How to find a job? How much am I gonna pay? But that came so easily that to this day I remember getting that check, and I was like, okay, then no, this is what chiropractor is. I was like, okay, this is awesome.
Cool. Okay, we're gonna finish up the school talk, but what did you kind of learn about yourself, Deigo, during that time? Is there something that, looking back specifically during your chiropractic schooling, that you say, man, like, I'm glad I went through that schooling because I learned this about myself, not necessarily the book knowledge, but maybe just did you grow up? Did you learn something specifically about yourself that you feel like going through that grueling schooling kind of helped you, realize?
In the last couple of years, I come to realize, like, I graduated in about 2018. I graduated, and back then I wasn't really thinking about what I actually learned, because I was just like finish, 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 finish. And now you look back, and you're like, well, like you said, what do you actually learn? Not just the books. Because I mean, to be honest with you, you guys, you have so much knowledge as a chiropractor. We know so much. The only difference between a medical doctor and us is that we don't go to the pharmacy side. That's the main reason. People don't understand that. It's just the drug side, we don't know anything about. I do, because I did my own research to find things like that. But in school, they don't teach you any of that. That's the biggest difference. But now looking back, it's discipline, knowing that it takes time to accomplish something. And also, I realized too, with school, it's not just, now I can read something, like before I would read 3-4 times and be like, oh man, what am I reading? But now it's like, whatever the topic is, if I sit down and I read it for an hour, I can tell you everything about it. So that's one thing in school, like reading so many papers, so many medical papers about it. It's just, at the time you don't think about it, but looking back, just like, I sit down, and if I don't know anything about the topic, whatever that is, you give me an hour or two, I research and I read and I read, and I'm like, oh my god, like I understand the whole thing. Like, it's one of those things that people like like massage therapists, personal trainers, they can read something and it's like what is this, right? Like, they don't know that they can maybe copy what people are saying, but they're not actually understanding what they're saying. So you see all this YouTube personalities, Instagrams, they're just repeating what they heard from a podcast from somebody else, but they can't say, hey, you know what? They can be like, like, just like a guy, so be like, hey, well, this shit will do this shit, and that shit will do it like that, like something that you can be straightforward. They start getting into, like, the chemical compound of the TPP, and then you're like, man, you don't even understand what you're saying, you know? So that's one of those things that really like takes me back, because you start using those long words, you know, and it's just nobody cares. Just tell me what is that going to do to my muscle, right? So that's what I took back, what I take from school more than anything, that I'm able to understand, you know, what I read. Like, I can actually take some time and be like, hey, you know what? This is what this does. The discipline that comes with school, knowing that if you put some time and effort, you accomplish it.
Excellent. Okay. So you graduate on Thursday. You have a job and a paycheck on a Monday, which is great. Now, walk us kind of through how you got into where you're at today, because you know, if some, like, I go to your Instagram, you work with you know, top Olympians. I've seen Brooke Walker, Hunter Labrada, Derek Lunsford on your Instagram, clients of yours. How did you kind of get into the bodybuilding realm in terms of helping these athletes in regards to being a chiropractor and their chiropractic care?
Well, as we know, COVID 2020, I was about to open. I was working for somebody for 2 years, doing personal injuries and slip and falls. We just work with attorneys, and it's not fun. It's just a lot of paperwork. There's really good money on it, but it's not fun. So in 2020, with my wife, I was okay. We have some money. I said, we're gonna open uh, a little office right next to the house. Great. So that was March 2020. So we put the money down and all that, and then the world shut down, and we're like, huh, okay, what do I do? I was like, should I open it? You know, I was like, well, this sounds a little funny, but I touch people for a living, right? So in 2020, it was touching people was a big no-no. So like that place I was working, we saw the patients going down big time. And then and finally the whole world shut down. So I was like, okay, well, that's not a good move, right? So obviously, as anybody, I was a little down, depressed, you know, because I had a plan, but the whole world was depressed. So it wasn't that shocking, but you know, a little bit of that. So, you know, again, like 2020, rough year. And I just, at that point, we knew we need to do something. But I was still a little down, whatever. And then we had, I had this idea of doing house calls. Yeah, and I knew nobody was doing it. Like, I was like, I never heard anybody doing house calls. And also, it got my attention because most people didn't want to come into the office. And the reason was, it was actually a pretty simple reason. They will call me and they're like, hey, doc, I'm not afraid of you because I know you're healthy. I said, but I'm afraid of people around, like in the office. And I was like, oh, well, if you're not afraid of me, then that means I can, you know, work on you. He's like, yeah, he's like, the fact that I have to get in the car, drive here, the gas station, all that is too many interactions with people at that time. So, okay. But I always had this idea. I was like, hey, why would it be a good idea to do this? What are we going to, and then finally I was like, you know what? I'm just going to do it. Why not? Right. Uh, so but my whole thing was, I know this for because working, you know, having the experience that I have, I already knew that I couldn't work with people who are super unhealthy, had, you know, some red flags that I knew there was no way I can treat them home. So I was okay. I can only stay with athletes who have, you know, joint pain, muscle pain, something that it's for me is it's something basic, you know, something I can treat at home. But anything else, if I knock the door and hey, I'm here, and you open the door and your elbows, you know, dislocated and you're bleeding to death, then I'm like, okay, well, that's a red flag. You should go to the ER. And you would think that some people they will think that they will have to go to the ER, but I had some people be like, hey, can you adjust my shoulder? I'm like, are you kidding me? Can you pop it back in place? I'm like, doesn't work like that, man. Like when I was like, well, first of all, if I pop it back in place, it's possible, sure. But I was like, but then you're gonna sue me. So I was like, I don't want to do that. So at that point, I was like, okay, let me do this house calls, right? So I'm going out there. I'm like, okay, well, how do I put my name out there? Because working 9 to 5 in the office, I didn't really know anybody. Even though I've been living in my town for like almost 5 years here, I didn't really know anybody because I was working from 9 to 5. I would go to the gym, house, and I didn't have any connections in the bodybuilding world. So I was like, okay, well, I definitely want to stay with athletes. And I was like, well, I know bodybuilding very well. Like bodybuilding, like I know it. Like that's what I want to work with. And so I started just working with like a little bit of like some coaches locally. And I send them a message on Facebook, on Instagram. Like, it's as simple as that sounds. Like, I just, hey, this is what I do. If you have any athletes out there, like, I work with you on me. Type my name out there. And then most of them, obviously, people like free stuff, right? So like, okay, yeah, let's go. So from there, I got the coach, and I will get 3 athletes, right? And at that time, I was charging almost nothing, right? So I got my name that way, and then next thing I know, I had a nice little side work, like little extra. I was okay, this is nice, no big deal. I didn't even care for it really. It was just like for fun. And then the Olympia was here in 2020. And then I went there and I was like, I went to check it out and I was like, oh my God, like I was like, I can work with these people. I was like this, they need it. I was like, I knew. I told my wife, she's like, yeah, you should do it. I was like, I want to work with these people. I was like, next year, I was like, I want to work with them. Like, I want to work with them, right? And then 3 months later, I started working with all the Olympians the same way, just like refer me. So I would say when I took it seriously, like I actually put my time and effort, I would say it grew up within 6 months. I was working with top Olympians. So by the middle of 2020, uh, I was already pretty good with my athletes. And the time when 2021 came and the Olympia was here again, I had already worked with at that time prior to 2021. I had worked with Hunter Labrada. I had worked with top 3 of the women's physique. Derek Lunsford at that time too. I mean, I had a good top 5 Olympians at that time, and plus everybody else. So by the time 2021 came for the Olympia, and it was in Orlando, in my backyard, it was just like boom, 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 boom. And that's really what set me apart, having those names out there and nobody doing what I was doing. And every time I work with somebody, like, I do my best because I know, like, when I see the bodybuilders, the top Olympians, even whoever it is, amateurs, I know like their body is their temple, right? So they're letting me work on them. Yeah. So I put like a lot of love and passion behind it. So I always do my best, no matter what that is. You could be amateur, you can be the top Olympian, but I'm always in the same mood. I walk in and I kind of match your mood, right? So if you're happy, I'm happy. If you're, hey, you don't want to talk because you're in prep, that's fine, But I do my best to put passion, put effort, because I know it's like, hey, this girl has given me the opportunity to work on their body. Like this is their business, is their whole body, and they're like, here you go, adjust me, work on me, do this, and I'm like, that's why every time I work with someone, I'm always like happy, enthusiastic, put in 100%. I mean, you can ask anybody I work with, and this is God on the truth. Everybody's super happy every time they post on their Instagram. It's not because I asked them, it's because they do, because they want to. Like, I have worked with so many athletes that I don't even post pictures on, because I'm not one of those guys that like, hey, let's take one for the picture for the Instagram, because I'm very professional when it comes to anything. So I like to approach it with a doctor mentality, and I'm like, hey, if they ask me, hey, let's do a picture, I'm like, of course, obviously. But I will never be like, hey, can we take a picture? Can we record this so I can put it on Instagram? Because I want to get that wall factor and people can see me. That's not me. So like, when you see in my Instagram, it's usually just pictures. But I don't really put my work because I don't like to record it. I think it's just, if they want to share and I can post it, that's fine because they want to. But I will never be like, hey, can I record it? Can I record your body and put it? That's not me. So that's what one thing I always try to be. Everything I do is very professional. I try to, approach it with a doctor's mind. Hey, this is for you. This is for me. That's it. Nobody else needs to know anything. If they want to post it, great. But again, like, going back to the 2021 Olympia and just knowing all these people, it was just like, once you're in that little circle of bodybuilding, because the bodybuilding is not, people think it's huge. It's not. So once you know those people, it's like high school, I tell people, right? So there's cliques, right? So there's like, not being mean, but it's like the Hispanics, the nerds, the bodybuilders, right? So once you're in that little clique, right, and they let you in, right, because the cool kid, and once you're in, that's it, right? That you're in. So then everybody knows. He's like, hey, Dr. D, Dr. D, Dr. D. So next thing I knew, I worked with like 40 Olympians that in 2021, and amateurs, forget it. It was great, and that's really what it set me apart. And after that, it was it was good. It wasn't a part-time anymore. It was, it was 50-50 with my other office.
That's cool. I love, this is why I love the podcast, Deigo, because we get behind the individual, we get behind the business, and it's exciting and enthralling for me. Okay, now, so you start working on these athletes. You in 2020, you're kind of doing house calls and stuff. So did you open up then at some point a physical location where people can actually come and see you? And have you stopped doing the house calls, or do you still kind of do both?
I do both. When I do in the office, I work with somebody, and then what we still only do personal injuries and slip and falls, because that's a good it's a good business. So now, because I was thinking about being in a facility in Orlando, but most of my athletes are like all over. So this, if I put only one side, it's gonna be hard to get to everybody. So now I kind of, not to be disrespectful to anybody, but I kind of pick my athletes now. So I only do house calls for my athletes and bodybuilders, because it just works better for both of us. But I'm a little bit more picky with my athletes, right? Because I don't want to work with just some one guy that I'm only going to see once a month. I want to work with somebody who's every 2 weeks, who's really into bodybuilding, who's really wants to go to the next level. Because if you have anywhere, any patients where you work with, if they only come in every 6 months, every 3 months, you're not really helping them out. You're always going to be fixing the same thing you fixed 3 months ago, 6 months ago. So when you talk to the patients and you're like, hey, you need to come in more often, it's not because I'm selling something, and most people take it that way. And I've seen chiropractors that do, hey, we need to sell you 1,000 adjustments and that'll be $10,000. And I work in places like that, and I'm like, this is wrong, man. And they're like, well, you're getting paid. So I was like, okay, whatever I have to say, but it was so wrong. Like, I didn't want. So I'm not like that. I'll let you know, hey, this is why. Like, you work out 5 days a week and you're destroying your body, right? So the idea behind the treatment is to get you healthier, better, faster, so you can be 100% again. So if you're working out 5 days a week, 6 days a week, and I'm asking you to get treated once a week for an hour, I was like, it's logic. I was like, use logic behind it. You're destroying body, 1 day of treatment. You think that's enough? I was like, it's good. So you need to do that. And then when you explain it that way, and again, with working with athletes, they get it, because they're like, oh, okay, 5 days a week, I destroy my body, 1 day treatment. Okay, that makes sense. So right now I'm only doing house calls, but later on I'm thinking in a year or 2 years, really just open a facility and then just hiring chiropractors and teaching what I know and just running more of the place. And then again, being able to still travel to different areas like the Olympia, the Arnold. So I still want to do those big shows because it's fun, meeting these people, just being in there, the energy. I mean, the Olympia, when I was there, you get to see all this different this different world of bodybuilding, how people love it so much. So it is fun to meet these people who I follow, the people who are like, they think they're gods, right? They're like, oh my God, this guy, Mr. Olympia, Mrs. Olympia. And then I'm working with this, and they're just chatting like you and me, like regular people. We're just laughing and saying jokes. So it is cool, and it is a sense of proud. Like you're like, oh my God, like this is, I'm doing something. And then on top of that, they're happy with your service, right? So they're like, hey, I want to tell my friends about you. So that makes me feel really good about myself. And I know I'm doing something for them. And so I know I'm better at their physique. So that's really the plan for now. But right now I'm enjoying where I'm at. I'm enjoying that I'm able to spend more time with my wife, my kid, and I'm able to travel to different places like Vegas for 8 days. I mean, that's fun. Like, and meet all these people, like not even, we didn't even go out that much. It was just working with the people, and just having fun. And to me, that's, making money and meeting awesome people. I mean, it's a win.
Absolutely. That's a big win, Deigo. I love it, man. Okay. Now I want to kind of get more into some of the practicalities of how you treat people, because I go to a chiropractor once a week. I get tissue work done once a week because I believe in it, right? And I've been to so many chiropractors because, just it's something that's been a part of my life since I was a kid. My parents took me to a chiropractor when I was a kid. So I know there's a lot of different ways to adjust people and treat people. Now, you just mentioned spending an hour with an athlete. Can
Mm-hmm.
you kind of give us what does that hour look like? Because on my end, and most people that are going to watch and listen to this, what we think of and know of a chiropractor, we walk in, they pop our back, our neck, and we walk out. It's maybe 5 to 10 minutes at most. But
Yes.
you are going very in depth. You're going next level.
Mm-hmm.
You're working with professional athletes. So talk about your experience and what's the difference between like a sports chiropractor and then maybe just like a chiropractor that's cracking and popping and you walk in and you walk out.
Okay, so that's a really good point that you said that. I mean, that's that you got it. Like when you walk into an office as a chiropractor, you have 5 minutes with the doctor at the most, right? And those are called personal injuries or just a regular adjustment. So what I do with personal injuries, yeah, you work with attorneys and they bring you the patient, and then whatever that car accident was, right? They have pain in their neck, so you're only going to focus on the neck because if you touch anything else, you can be sued because they didn't actually mention at the beginning, right? So you're not ever going to work on their back if they didn't mention at the beginning of the first appointment, like, hey, my back was hurting. You can't really do anything, right? So you walk in, you work on the neck, like you said, 5 minutes, pop, you're out, right? And another scenario would be it's a numbers game. You work with Medicare insurance, so you gotta pop as many necks as possible to achieve that goal, that money that you want to achieve, right? So it's just more a money maker and more of just a numbers game. The more they come in, the more money you make. I don't do it like that, and that's why I don't like that chiropractic side of things. My treatments are completely different because I combine physical therapy, massage therapy, and chiropractic care. So it's three things that I combine, So I will work out my if their shoulders are hurting, I'm like, hey, let's get the bands and work on that. So I work with them. We'll put some cuppings on top of it, right? Well, if I walk in and I know that you don't need an adjustment, sometimes you're like, hey, I know, like, hey, this guy, it doesn't need to be his neck doesn't need to be pop or back, right? I said he needs some light tissue work, so he needs some massage, right? So that's what I do. I will go in there and work on that muscle, work on that muscle, work on the muscle till we release the muscle. Because most of the time, sometimes you don't need to pop people. So that's why it's like you're chasing that crack all the time, and you're chasing. I like to put it, you're chasing the wow factor, right? Like you pop their neck, and this person is like, wow, like it's incredible. You pop my neck. You heard that sound? Like, I don't care about that. Like, I want to make you feel better. I want you, like, the next day when you wake up and be like, oh, my neck's not hurting. Not like, oh, I got a big pop and now my neck's killing me because he went so rough. So combining that in having that knowledge that I have in experience and not really chasing that wow factor, it sets me apart because my main goal is to make you feel better. I want you to be happy. And then chiropractors in an office, that's why I can't do what I do in an office and then charge what I charge in an office. Because if I had, a location and then working with athletes, I would have to charge probably 3 times what I charge, right? Because I need to pay for the lights in the building that stand. So, and it's just not feasible. You can't do it like that. And again, like, most times you go in the chiropractor, they pop your neck, you're done. Here, I'm spending times, like, again, you walk in. So a typical treatment on a bodybuilder. First, well, I need to get to know them, right? So I'm not gonna say, hey, get on the table. I'm gonna pop your neck because subconsciously you're thinking, who the heck is this guy? He's gonna break my neck. Like, you're okay with it, but deep inside or here, it's like, I don't trust you. Even though you know everything about me, you still think, hey, he's gonna mess my neck up. So first we have a little chat, we get to know each other, do a couple tests to see what the problems are, and make you feel comfortable. Then I will start doing with maybe a percussion gun. Then I'll start stretching and then you start getting to know me. We start talking, like little stretches, and then you get how I work, right? And then you're like, okay, he's not trying to kill me. He's a big guy. He works out, but he's not gonna just go crack, right? So I work it little by little, and then when I know that I just know the body, so I know when you relax, I'm like, okay, now I can go a little deeper, right? So now we can really get to the source of the problem. So let's just say it's your neck that's bothering you, and that's something that's your pain. I will start with your lower back, right? Because I know that's not hurting you, so kind of work your way up. So little tricks like that, right? That it really gets you confident. If I'm working with a girl, I'm not gonna be like, hey, go face down, right? It's just, what the heck, you got to get to know them. You have to be, you work in the opposite sex. You have to understand that they're uncomfortable with you, being a male, female. You have to make them feel very comfortable, and then you can proceed to do what you need to do. If you're working on their hamstring and it's a female, you're not going to go, hey, and I've seen this before, like, okay, lay down, face down, let me see your legs, like, you can't do that. So that's why sometimes it takes me, and that's one thing that people always, I say, hey, how long does it take treatment? And I don't really like to give people numbers, because in this society in America, it's all about numbers, right? So they're like, how's it going to take? Because you're a massage therapist, so it's 45 minutes or an hour. So I was like, no, first of all, I'm not, and then the treatment will take about 45. And if it's an Olympian, and I know it's going to take a little bit longer, because let's be honest, they're in a different time zone because they're doing prep. So there was a little late, or they need to eat or something. So I'm like, it's going to take between 45 to an hour and 20 minutes, because I know their schedule. I know how they are. And then by that time, I get to know them, and we do it, little by little, and we work our way up. And that's really when I get that confidence, and people get to know me. I think that's when they feel very comfortable with me, because we're actually get this connection, and we're like, okay, we can do this. And so I like to finish up my treatments with that chiropractic adjustment. So we do stretches. If we need to do cupping, we need to grasping, the scraping, electrical stimulation, percussion gun, ultrasound, whatever that is. I combine that. I have everything. The ultrasound, everything I bring, and then at the end, I think what really sets me apart from like the typical massage therapist, it's the chiropractic adjustment. That's really the key of my whole treatment. Once I adjust them, it's like, oh wow, pain is gone, or their range of motion is completely different. They get on the table, and then that's a good thing about top athletes. It's that they know their body so well that once they get on the table, they know the difference. You see, that's because those little differences they make, right? There's like it's like a whole new world. It's like, wow. And that's the best thing about working with them, because they know those changes are huge, right? So they're able to turn out a little more. They're able to flare up their wings more, their biceps, their triceps, right? Their traps, their glutes are popping more. So all that changes everything, especially for presentation and posing. So all those changes, and then once they see it and they look at themselves in the mirror, they're like, all right, doc. I said, wow, this is incredible. And, those are the changes you want after the treatment.
Now, I'm assuming that when you were going to chiropractic school, they didn't teach you like this process. This is something that you have learned over the years and developed yourself. So I guess my question is, Deigo, because again, I'm assuming, because I've been to so many chiropractors and they all kind of do the same thing the same way. It's 5-10 minutes, crack, pop, walk out. So how did you kind of develop this process with these athletes for 45, 60 minutes, upwards of 120 minutes? How did you develop this, in terms of what you provide, this experience you provide for these athletes? Talk about that, because I think it's very unique what you do. And I want people to realize that, yes, we can go to school and get quote unquote education, but I think it's up to us to continue that education, to continue to develop and evolve as practitioners. So just touch on that, please.
Well, thank you for recognizing the uniqueness of my treatment. And one thing that sets me apart, it's growing up in the business of bodybuilding, right? Working out since that young age. So I know what you need, right? I know what needs to be done, because I feel this and I work it, and I've been working on my body for such a long time that I know what you need and you don't need, right? So that's really what sets me. Everybody else, like you see this, people that are working, they're overweight, they don't practice what they preach, right? Me, and Sam, I'm always, hey, eating, diet, wellness, all that. It's all part of my lifestyle, my wife, my kid. So just knowing that already, that knowledge is from experience, and you will never get that anywhere else. Two, again, being in school, you go to shadow people, right? The different doctors, and you start seeing all these things that you're like, well, this is wrong. And I'm like, you don't say nothing because you're that student, right? So like, this is stupid. This doesn't make any sense, right? Walking in, they pop neck by next one, right? And then I started working with different offices after I graduated, and I'm like, what the heck is going on here? Like, this is not right, like 10 minutes, like you need to actually spend some time with this patient. They need to get to know you. That's the whole idea behind a chiropractor. You make that connection. So it was more like I guess my Hispanic side too of, being more nurture to the people and always welcome them in. That's one, the experience that I have on my own as a bodybuilder. I mean, well, I would say more like a side bodybuilder, hobby, but I grew up within, and the experience of being in places that I knew they were doing it wrong. So I knew what I wanted to do it my way. And that's why I took charge and I did it my way. And that's how it worked out. And again, you start working with the amateurs right away. And I start reading. I say, this is what they need, right? This is what they don't need, right? So I knew that you can't just walk into somebody and be like, hey, it's 10 minutes pop and that you need to do more. And like I'd say within the first month, I really knew how to like really work with these people. And then by the time I was, in the year now with the experience that I have, everything has changed. Like I trigger points for the bodybuilders and working with this massive or unique bodies. I'm working with like the 1% in the population, right? So they come to me because they know, like, you might have this experience with all the other doctors or whatever, but they don't have the experience that I work with the 1%. So the bodies is so unique. So it's just, I know where to press. I know what looks good. I mean, I can look at a body nowadays and be like, yeah, that's definitely a pro body, or yeah, that's not good, And maybe I knew this like a couple months ago, a year ago, but I never really said anything to anybody because it was just like, that's not my part of the business. That's not what I want to do. But because I work with so many of these athletes, I can say, hey, well, this is like, you should take what I tell you and with a good heart, because I usually say things because I want you to be better. So when I say things like, I know what I'm talking about, because most people don't know, they don't have the experience, and they just start talking and they're like, well, this and that. And I'm not that guy. Like, if I don't know anything, I'll keep a mouth shut and I'm like, well, I'll just listen, because that's not, I don't know that. So I was like, okay, cool. But when I do know, I like to speak up, because it's just, I'm like, I know you're doing it wrong, and comes from a good place. So hey, do it this way, or this one needs to be changed. So that's how I was able to perfect my treatments, and just combine everything that I know and trying to provide that to my patients.
Excellent. Okay, we're going to finish up here, Deigo. But before we do, I want to touch on a couple more things here quickly. Now, in terms of lifting weights, whether you're a power lifter or a bodybuilder, or you just do it for the wellness of it, or the health of it, fun of it, how can we in the gym protect our spines, or keep our spines from getting injured? Like, I've had chiropractors tell me that I should never barbell squat ever again. There's all kinds of misinformation, fake news, so to speak, out there when it comes to your spine and lifting weights. So can you kind of give us some insights, just maybe your top 3 things that we can do to keep our spines healthy, not get injured while we are training hard as athletes?
Yes. But when it comes to all those things that they tell you, hey, don't do this, don't do that, that's obviously untrue. You just need to learn how to do it differently, right? You need to evolve, right? So I have a lot of this the bodybuilders that are older, they're pros, are 55, 50 years old, 60 years old, even the 40-year-olds, but they have injuries in the past. So the problem is with this mentality too, is that they don't like to change the way they train, which that does need to change, right? So if you're, in dumbbells, barbells and all that stuff, if you're 45, you have, 2 injuries in your shoulders, surgeries, or whatever it is, yes, okay, we need to not stop, because you never want to stop, but you need to evolve and change, right? Because now your body has changed, so your training needs to change. So I like to, I always like to say like that to people, because just this when it comes to power lifters too, they don't like change. They think that pain is gain, right? It's like, oh, if it doesn't hurt, I'm not getting stronger, I'm not getting bigger. And that's really not a good way to think neither, because you never know what's real pain and actual muscle soreness. And that's how you injure yourself. And that's how a lot of powerlifters actually get out of the sport, because they have a tremendous injury and they don't know. They think it's muscle pain. Even bodybuilders, they think, hey, it's just, it's just regular pain. It really isn't. It's more than that. So just evolving your training, that'll be number 1. And 2, it all depends what you're going for. If you're a bodybuilder, we don't need to do you don't need to live like a power lifter. We don't need to go for the max every time because we're going for looks. So all the top Olympians I work with, have you seen, go search their Instagram and their YouTube channels. Do you ever see them doing a max out? Doing it looks like they are because they're super strong and they're huge and they're not normal people like you and me, right? So you're like, oh my God, they're maxing out. I gotta do that. But that's not their max out. That's like 75, 80%. It's a heavy day, right? So they're never maxing out. So you have this mentality of people like, oh, I'm maxing out to get bigger. Not true, right? They're doing it for your looks. Bodybuilding is all about symmetry and looks, right? So it's the package that you bring to the stage. So if you go there thinking, oh, I might get bigger lifting big weights, you're just gonna hurt yourself. So definitely know what you can do and what your max is, and don't push it. And then when you start feeling those pains that you don't know what it is, those needles, in your shoulders, in your legs, that's not regular pain. That's the difference. Get it checked out, get an x-ray, get an MRI, seek some medical help, because that could turn into something else. A little pulled muscle can later become, a tear muscle, a rib. So that's really when it's going to stop your career. And and powerlifters, they definitely need to change their thinking sometimes, because again, like they just like heavy, 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 and so it's a hard sport, But yeah.
Okay. Is water and staying hydrated something that's really important in regards to like spine health? And we know it's important for overall health, but in terms of like our spine specifically, is staying hydrated something that is very beneficial?
Definitely, it's definitely, like you said, we all have to stay hydrated, but also implement some stretches. Not just you want to stretch after your training, right? That's the best way, because a lot of people like to do the static stretching. Usually the hold, right, the 5-second hold before the workout. But studies have shown that you want to do those stretches at the end of your workouts. So you want to work out with dynamic stretching. So, jumping. So let's just say you're doing chest, right? And it is all going to benefit your spine in the long run. But let's just say you're working on chest. You don't want to do, static stretching, right? You're holding it. You want to do exercise that actually going to work those muscles. So instead of doing like those statics, you do dynamic stretching. So you will do a push-up on the wall, right? You do 15 of those, which is super easy if you're bench pressing. So that's how you warm up. That's dynamic stretching. And at the end of your workout, you will do the static stretching, because what we do, right? What do we do as athletes, as bodybuilders? We do 110% in the gym, right? You're working out heavy weights, right? You're there for an hour and 20 minutes, and you're like, I'm ready to conquer the world, right? And you're pumping, you have blood everywhere. You're like, this is awesome. So what do most people do after that, right? You go straight home and you sit your ass on your couch. So there's nothing in between. How does your body go from 110% running wild? You're all like super far enough from that to sitting on the couch eating your meal. That's wrong. You see? So again, logic, right? What do I do in between? Okay, I need to do some dynamic stretching. It slow down my heartbeat, bring it down, stretch the muscles, stretch my spine. And that in the long run will reduce your muscle soreness, the pain, it's going to lengthen your muscles, it's give you a different look. All that's part of a bodybuilding. So even though it takes time, people don't want to do it, you have to. If you want to be top athlete, top bodybuilder in the world, those are the steps that they take to be better. You walk in there and you just lift, and then you do whatever. Like you can lift better than anybody in the world. But if you're not putting, the vitamins, the food, you're taking enough time to do treatments, taking care, you're not gonna grow. Your career's not gonna take off. Working, you can be the best workout guy in the gym. It really doesn't matter. But you need to do all the other steps that those athletes are doing to become the top bodybuilder in the world.
Excellent. I think that's a great place, Dr. Deigo, to end it. Thank you so much for coming on and sharing a little bit of your life story and your chiropractic story with us. Before I do a quick outro, if you have any final thoughts, any final words that you want to leave with us, I'm going to turn it over to you. Please make sure you give us your Instagram. If somebody wants to connect with you, is Instagram the best way? Is there a website? Any shout outs that you have, anything you want to leave with us, platform's yours. And then I'll do a quick outro and I'll let you go. So what do you have for us in closing?
Well, thank you so much for having me here, man. It was a really nice, it was a great talk, man. If you want to reach out to me, you can find me on Instagram. It's the best way to reach me. You can also see my website there. It's called Max Muscle Labs. It's on the top of my Instagram. DM me for any questions. And if you're in the Orlando, Tampa area or Brevard County, I can definitely work with you. Just, again, send me a DM and I'll see you there.
Excellent. All right. Thank you so much, Deigo. Really appreciate it.
Thank you so much, man. Appreciate it, man. Thank you.
You're welcome. Absolutely. All of you who are tuning into another episode of Behind the Muscle podcast, I just want to say thank you so very much. If you guys have not done so already, make sure you hit that subscribe button in regards to Behind the Muscle podcast on YouTube. Also, please take this episode with Dr. Deigo, share it on your Instagram stories. Make sure you tag Deigo, tag Behind the Muscle podcast so that we know you listened specifically to this episode and found great value in it, in which I know you did. And then finally, I will leave you all with this. Remember, behind the muscle, there's always a story. We'll catch you guys later.